There we go. There are lots of people who would love to join this call. I appreciate that some of the things that we mention might not want to be shared more widely, so please be aware of that when you're talking. This feels like the fairest way of doing it, to share for other people who aren't able to make the call. If we feel like we want to do another one of these, then that's great, let's do it. The purpose of this call really is to have a conversation and to talk about what we think a set of principles might be around supporting services to respond more quickly to crisis situations. So the outcome of this session will be the shared document, which I shared in the chat and on Twitter earlier. So please do continue, as I know a lot of you have done, to kind of type into that if you feel like you don't necessarily want to talk during the call. But if you do, that's fantastic, because we've got an hour to have a chat and it can't just be me. So let us begin. I think we're going to try and sort of spend the first kind of 40 minutes just talking about the kind of different sections of the document that I put together. They aren't exhaustive, but they are meant to be a kind of list of the types of stages that a user would go through. So helping people to understand what's happening, helping people to know what they need to do, helping people to take action, helping people to survive, helping your organization to quickly support the change that it needs to. So let's sort of spend the first 40 minutes talking about those things. Then we'll move on to the kind of, I suppose, the kind of question really that sort of puts all of those into perspective of, if you had to kind of ditch all of the above and you just had 24 hours to do something, as many of us are in the situation on right now, what would we do? What is the most important principles to kind of get right for users? So yes, let's start. Would anyone like to kind of kick us off by talking about the first principle, so helping people to understand what's happening? I can see lots of really amazing contributions there already about communication clearly, using multiple languages. Someone linked to the text that was circulated on Reddit, and apologies, I don't quite know who did that, but the less clear version of practicing social distancing versus the kind of much clearer version of staying at home, get groceries once a week. So yeah, who would like to kind of kick us off in talking about that? And if you could talk in the chat and then let me know, and I'll bring you into the conversation. Anyone?
Hello there, can you hear me?
Hi, yes, can hear you.
Okay, so since it's taking a little bit of time to start the chat, I'm going to start with principle one. First of all, I just realized about this call happening, which I think is a great idea. So thank you, Lou, for setting this up and encouraging everyone to join. What I would like to add about the first principle is that I believe I'm currently speaking to you from Madrid, from Spain, and I think this is really important because I'm not sure about any other country situations, but what you are watching in the news and also what you are reading on the newspapers and on the press, I'm pretty sure that it's quite different from something that is being told in Italy or UK or anywhere else. So I'm not sure if anyone is aware of this or would like to share experience about this.
Yeah. Thank you for that. Just lots of people mentioning on the chat, again, please, if you're not speaking, put your microphone on to mute. Someone who's got the TV on in the background, I think. Okay, does anyone want to kind of respond to Daniel's point there?
All
So
right. So just to clarify what the point is. So my point is that given that this is a global situation happening everywhere in the world, my assumption or what I'm perceiving is that the Spanish media, news and press and newspaper, they're telling their story, which I believe will be different compared to, I don't know, Italy's stories or UK story or somewhere else, something else happening in the United States. So I think I completely agree with the first principle, which is helping people understand in a transparent and honest way what is really happening and what is the impact that this outbreak is having on everyone's lives. I hope that makes my point clear.
Yeah. No, it does. I think the point you're making also as well brings into kind of focus a lot of the other things that are mentioned about making sure that your facts are clear. As well as you kind of pointed out, there are very different accounts in various different news outlets that are completely different. So Erin has also just contributed on the chat saying in Australia, each state and territory is doing its own thing, but only a few nationally consumed daily newspapers. So there's a really good point there about how do you scale a message, and how do you make sure that what you're doing is actually responding to the right advice and guidance, not necessarily the one that is local to you, or one that's different to another one. That's a really good point there. Thank you, Daniel. Does anyone else have any kind of points they want to talk about in terms of making sure that you help people to understand what's happening? Yeah, Tom, you said you want to come in on point one.
Yeah, so just an observation really. If we're talking about what is happening is changing all the time. And I think that when people are looking for information, the issue of trust kind of and reliability comes in knowing how up to date that information is at any given moment.
Yeah, that's a really good point. Yeah, Dana, you wanted to speak.
Yeah, I think it's interesting talking about the global spread of information, but at the same time, a lot of the services that we're talking about are delivered very regionally at the municipal level. And so making sure that people know where to get the information that's relevant to the day-to-day services they're depending on is going to be really important, because they are, particularly in Canada, one of the reasons our Prime Minister hasn't enacted the Federal Safety Act is because it removes powers and communication paths from provinces and municipalities. And right now we can't afford to do that because a lot of those services are delivered municipally.
Yeah, that's a really good point. So yeah, even if your news sources have to be kind of nationally corroborated, what does that mean at a local level, and how do you kind of make that relevant to people in their place? I think is a really good point. Maddie, you said you've got some more info on that point.
It's really just I suppose an attempt to coordinate an effort here in Scotland with the voluntary sector, so with the not-for-profits. The Scottish Council for Voluntary Organisations have set up a website that is signposting people to reliable sources of information via the NHS and government. So it's a place where people can go to get the facts as opposed to people's opinions, and it's that also about trying to find out what is reliable, what isn't, so we'll be able to tell the difference. It also has information for funders and different ways of working. A lot of voluntary sector organisations have found themselves trying to immediately provide face-to-face services remotely. So it's a kind of a way of helping that. I suppose that's kind of creeping into all the other points that we're going to talk about. Yeah. But I don't know if that would be of any interest to people to see. I can post a link to it in the chat box, I guess.
Yeah, that would be really, really helpful. Yeah, I think you're absolutely right. I think that this will come much later when we talk about how our organizations can respond. But how do we go from providing primarily face-to-face services to immediately then providing online services? How do we do things like identity verification and some of the caring things that we're providing? I think are really, really good points. Who else have we got on the chat? Ariel, Doug, or Dan, you've kind of mentioned some stuff here. Is that something you want to talk about?
Okay, yeah, so Dan here. Just my observation is that I think it's important from the outset that, if we are working across multiple organizations, multiple silos and so on, that we really make sure that the SLTs there really understand the basic principles that we're coming at from service design first as well. And we've got that agreement so that we do have everybody taking, an agreed approach in these situations.
Mm. So you talking about the need for a kind of shared understanding across multiple different partners there.
Absolutely.
Yeah, I think that's a really good point. I think we can sort of add that to the sort of the end point around how do we help an organization to cope. But I think that's a really good point. Many of us are in the situation where we are having to kind of deal with multiple different stakeholders in this kind of world. Does anyone else want to come in on the first point before we kind of move on to the second one?
Hello, Kuretau. Hi, I'm Mario. I'm Brazil. Here in Brazil, people just don't trust so much the facts. So people are spreading the news on the COVID in WhatsApp and mostly using stories, telling stories about what can happen to them and their families. And more than using facts and data, we are using here more the emotional approach to share the thing.
Yeah. So you sort of saying that sometimes potentially the facts that are given by the kind of mainstream media sources are potentially not appealing to people in the way, yeah, okay, because their friends and family are saying things that are much more emotionally in tune. I think it's interesting, there were quite a lot of mentions actually about treating people as people and understanding their emotions and their fears and actually responding in kind with with human language that helps them to understand. But I think that point about emotion is a really, really good one. Hello to everyone who's joined, who was in the waiting room. Apologies you couldn't get in before, but welcome. We're still talking about point number one, but I think given time, we probably need to kind of move on quite quickly to the second one. Does anyone have any last points on helping people to know what they need to do before we go on to the second point?
No, good.
No. Okay. All right. So let's move on to the second point, which is really around, I guess, once you've helped people to understand what they need to do. And by the way, we're racing through these, so apologies. We can't get into lots and lots of conversation as I would love to. I think we should probably have a second call that is probably much bigger. About that, but let's move on to the second point, which is really around helping people to know what they need to do and take action. So what is it that we think is kind of the most important thing in that kind of space? So just once people understand, kind of what is it actually happening, what do we need to do in order to help them to understand what they then need to do in that space? Any thoughts?
So here in Spain, in Madrid where I'm based, something that I'm observing that it's happening is that we're constantly being told to stay home and only go out do essential shopping like food, go to the pharmacy to get some drugs, anything that it's really essential to do for you outside home. But for some reason, that message is not being clear, and there's still people going out, there's still people taking the risk, going to places where there's other people. So that makes me think and question, are people aware of what they need to do? Where is the message unclear? Is that they don't understand the situation? What is their motivation? That's the kind of questions that I'm asking.
Yeah, it's a really good point. I think part of that does come back to the kind of point around kind of clear language and being very transparent about what you're asking people to do. But there is something more about helping people to know specifically how that applies to their life as well. And in the context of many different services, we're not just talking about kind of generic kind of action in people's lives, but you know, if you're a carer, for example, what does that mean for you? If you are, you know, kind of looking after children, what does that mean? There's lots of very specific advice and guidance out there that kind of needs to be very clear for people. So who else have we got on the chat? So Dan, you said that you agree with the last kind of point, and Peter as well. Do you want to kind of elaborate on that? Oh, Zoe's piped up. Yes, Zoe. Yeah, absolutely. Go ahead.
Hello, thank you. Yeah, I think maybe an initial barrier to getting to that point of knowing what to do in a specific case or circumstance is letting people know how they're categorized by authorities. So, for example, if you're a young carer and there are certain things that you have access to, you might not even know that you're classed in that situation to begin with.
Yeah, I think that's a really, really good point. So often we presume that people will just kind of know their own status. You know, I know that I'm vulnerable, or I know that I'm not, or I know that I am this person or that person. And actually helping people to understand where they fit in that space is such an important point. Yeah, thank you.
Sorry.
No, go, please carry on. Yeah.
Just in the case of carers, I think that's one, but also in terms of people who are currently in unemployment, it's quite a complex situation for why people are losing jobs at this time. And I don't know, from what I've seen coming out of UK government and Scottish government, those categories are quite limited, and actually there's a wide scope of reasons why you might have lost a job, and each of those contexts requires a different kind of support.
Yeah.
More clarity on the specificness of situations that you might find yourself in.
Yeah, it's kind of one of those situations where actually personas go from being a sort of hypothetical thing to actually something that's quite functional within your service. It's a really good point. Thank you. Sorry. Peter, you wanted to add a point on this one.
Yeah, so it was just on the point of giving a clear explanation to the people who don't feel like they're affected by an issue. You know, if someone's really healthy, the job's secure, they're not at risk of being impacted, they still need to know why they should stay inside, why they shouldn't go to these places, because maybe they're not at risk, but maybe they're putting other people at risk. And I think sometimes it's a struggle to get that point across that, yes, you'll be fine, but other people might not be. So maybe like sharing how something spreads. Or
I think, it's a really good point.
Can I say to that point, thanks. Peter, you were saying to help people understand why, having a picture of how it passes around and what the mechanism, is that helpful or is that too medical?
You raise a good point. There may be ways that information could be simplified. You know, I've seen a lot of things with like analogies, like using images with matchsticks. I saw, or someone posted like a type of graph that showed, someone didn't go out to the pub, someone didn't go to a party, someone didn't go somewhere else. And I thought those were really clear. They were just short, like GIFs or images, but it got the point across really quickly. But again, not everyone's going to see those, and they're not shared on the mainstream media, they're shared on sort of social media and stuff. So, I'm not sure how that's best communicated.
Yeah.
I think there's a bit of room for specifics there as well. I think there's a feeling at the moment that it's almost like everybody's an idiot apart from me sort of mentality. And people need to understand why it is that their kids just being the ones that going out to play aren't a good idea, or they being the ones who just go to the seaside isn't a good idea. It's trying to get that message across to people that there are specific actions that they might think that they are taking as the only ones who need to do it. But when everybody's doing it, we get the situation that we have now.
Yeah, really good point. I think generally explaining why something is happening is always helpful, even if you're in a non-crisis situation. Helping people to understand why they're paying tax versus any other scenario is helpful. So yeah, there's some people agreeing to that point. Okay, are there any other points on helping people to know what they need to do before we move on? I feel terrible kind of rushing people through these, because I feel like each one of these deserves probably a couple of hours of conversation, but any other points on this one?
Hi everyone, I'm Chloe, I'm from Paris, France. I just wanted to share my experience in terms of how people understand what's going on and understand the precaution measures that they have to apply to their daily lives. I see a very, very big difference in terms of, on one part, people who read foreign media, or people who are on Twitter, for instance. All of those knew, like, 2 weeks, 10 days in advance what was coming and how to behave. And then on the other part, it's people who only read mainstream media or who watch TV. And it took a while for the second part of people to understand what's going on, to learn that it's important, that it's not just the flu, and that you should apply measures. And so, yeah, I really see this difference in timing.
Yeah, I think it's a really good point. And someone was talking on the chat, Amy, about creating kind of new social norms and helping people to really understand, I guess, the kind of behaviors that other people are taking, and so that they can kind of respond to that. But yeah, really good point, Chloe. Thank you. Does anyone else have any points on this one before we move on? No. Okay. All right. So moving on to helping people to take action. I guess this is really the bit where, regardless of what your service is, if it's a support service, if it's not necessarily a support service, but another service that someone is using in their daily lives, what do we need to do in order to kind of help people to take action, either to not use your service, for example, if you're a supermarket, please don't come in, or to actually kind of take action to protect themselves in any other scenario? What is it that we might need in that kind of scenario to help people to take action? Any thoughts?
Hello, I just would like to share, it's here from Berlin. I'm Renzo, and when I speak with my parents in Italy, they share their experience where they go to supermarkets, and they are extremely crowded. So here in Berlin, for example, they are not yet so crowded. And just wondering, when I was listening before, is if there is any way that there could be kind of a timeline for each area to go a certain type of supermarket, to split the traffic of people that go to the supermarket, and maybe giving some information in terms of what are the best times to turn up according to the type of people. That could be families or could be elderly people. Just wonder if there is any opportunity to create a flow of people that go to the supermarket.
I mean, that's certainly been, I think, thought of in a couple of countries. Certainly here in the UK, we have kind of opening times for key workers, so people working in healthcare services, and also for people over 70. But it's a really good point that actually there may be other services that also need to kind of potentially think about scheduling and means of access, and thinking about the times in which people access your service, I think is a really, really good point. It helps them to plan their day ultimately. So anyone else would like to kind of come back on that? We've got quite a lot of people sort of talking on the chat about it. So people talking about children being banned. Yeah, it's happening here as well.
I think one thing that I'm noticing is, and it's probably like I sometimes sit in the digital bubble. My mum has a very basic phone. She lives in Cornwall, is sort of, isolated out and doesn't check any messaging that goes out digitally. And I think there is a little bit of forgetting that, some people aren't checking Twitter, aren't checking websites. I don't think she's ever been on .gov, and it's things like that that we tend to take for granted. My LinkedIn at the minute is covered in how to remote work. I think everybody on LinkedIn in my profile knows how to remote work. And I think that's the thing. At the moment, we're stuck in our silos telling each other how to do what we know how to do. And there's a lot of people stuck outside that who, you know, do we have to go back to flyers and things like that? And so, you know, in Manchester, when it went really, really cold, one initiative that I saw that was amazing was people were taping little posters, A4 sheets of paper that anybody could print out, so homeless people knew where they could go. So it's things like that, thinking a little bit outside of how we normally communicate.
Yeah, the channels we're using are so important. You're absolutely right. I mean, most people's social media is a carefully curated bubble, to which most of mine is actually pictures of people on Zoom calls and remote working, and I'm sure we're all in a very similar situation. Anna, you said you'd like to come in on this point here.
Yeah, hi, my name is Anna. I come from Slovenia. So just wanted to share a bit, and expand on Tasha's point a bit. Yeah, so I spoke to a senior in my building that I'm doing shopping for now. And they come across problems such as, how do I pay my bills at the end of the month? And the pension will be coming in, and they're still using their old bank little books. And they have no idea how they're going to be doing this right now. And we're going to have potentially queues of elderly people at the banks or at the post office getting their money and paying for bills. And there's no such thing as they don't own smartphones, or if they do, they don't really know how to use them. And it's something, how do we have basic, and these I think are still going to be also for the economy really essential services, so that people pay their bills and are able to do this.
Yeah.
So just something, how do we get that accessibility to people that are not in any way digital, that are still living in the physical world completely.
Yeah. And it comes back to the earlier point there about what are the channels that we're using to communicate with people. But your point is kind of building on that, saying it's not actually just about the channels we're using to communicate, it's also about the channels we're using for people to be able to do things.
Exactly, yeah.
Yeah, really, really
good. And I actually did call a bank today to kind of find out if they have a solution for this yet. And as of now, nothing yet. And they're basically counting on people's families and younger, I don't know, like kids or grandkids to basically do this for people.
Yeah, exactly. Which kind of, I guess, exposes a problem that has been going on this entire time. If people are relying on family members to provide a service for them because they can't access the thing because it's in a format that they're not able to, then that was always something was happening. Thank you, that was a really good point. Would anyone else like to come in on this point around kind of the ways in which we can help people to take action? So we've had some really good points on the channels that people use. Anyone else got any other kind of points?
Can I come in?
Yeah, please do.
Hi. Yeah, I think this is a very interesting conversation. I think I agree with all the points made so far in terms of how do we provide and give better guidelines and better how we design our lives better for people. But I think it comes to a point where just guidelines without, no matter how clear and well designed they are, without proper enforcement, that's not going to get us anywhere. And we can see cultural differences between different countries. We can see, for instance, that in countries, especially in the West, where you have such a strong individualistic culture, such limited sort of awareness of the collective, it's going to be much more difficult for people to respond to those guidelines, and it might be actually needed to take stronger steps towards enforcement. We can see shops around here which are very small. There's no guidelines for them in terms of like how many people do you let in. There's always people breathing on your back when you're queuing to buy stuff. There's absolutely, and although there's I think we're bombarded with information about social distancing and keep the distance, but nobody, a lot of people are not taking this seriously. So I'm wondering, like what advice we can give to the enforcers, and how we can, how some sort of kind of soft enforcement can be embedded into these guidelines as well.
Yeah. It's a good point, and I think comes back to quite a lot of the things that people have mentioned on the chat, and also in the collaborative document about acting in a humane way. A lot of the enforcement that people have talked about previously has been very much in a kind of traditional understanding of enforcement, but we're in a scenario where actually that enforcement should be more compassionate, probably, because those people are potentially in a situation where they either don't know, don't understand the situation, are in active denial of that situation, and need to be kind of treated with care and respect. That's a really good point. Thank you. Okay, we're going to have to move on to the next point, unless anyone has any other points on helping people to take action. No. Okay, thank you. Okay, so let's move on to helping people to survive. I suppose this is in a kind of a continuation from the previous conversation of, once people have sort of taken action, there are other things that sort of support the survival of folks, which is not just to do with medical survival, but also financial survival, getting access to food, paying your bills, various other things. So would anyone like to kick us off in talking about that point?
I think that this is, I see this as a consequence of the first three principles. So if people understand what's happening and they know what they need to do, and therefore they need to take action, those actions and those measures, they will help them to survive. So I see this principle as a consequence of the previous principles.
Yeah, completely. I agree. I mean, this was me thinking about the sort of the different areas that we might need to think about principles within, but I agree. I think this is a continuation of taking action. Ultimately, if your action is successful, then it leads to people being alive, which is good. We can move on to this one, onto the next one, if people feel like this is just a sort of duplication. I noticed there's quite a few additional kind of points here, unless anyone would like to say anything.
Can I just make a quick comment, not for us to necessarily explore here. Hi, this is Ijama. But thinking about this as beyond survival, so looking at how people can thrive and flourish during and beyond.
Yeah.
Because at some point we will shift. Either this will progress, resolve, or stay the same. But thinking around thriving and flourishing, if this is going to be a new normal.
Mm-hmm. Yeah. Yeah, I think that's a really, really good point. I mean, we're talking about months, potentially years, but depending on the vulnerability of some people, and actually there's an adjustment to a new normal life, which, actually many of our kind of key services in our lives have a really important role to play in helping us to adjust to that way of living. So I think that's a really good point. Thank you for sharing that.
Just on that thing about the new normal as well, I think once you recognise that in these situations, new networks will be constantly appearing, and other networks will maybe achieve prominence they might not have primarily expected at the beginning, and just to recognise the fluidity of that, and networks as they appear, whether that's from Facebook or church or things that are happening at the end of somebody's street. There's going to be whole new relationships created during these quite turbulent times.
Yeah. Yeah, absolutely.
Can I come in on that?
Yeah.
Because a lot of the conversation in the UK fails to recognise there's already 168,000 charities who've been working on the front lines, helping people in the local environments for many years. And while it's great to see all the COVID groups starting up, there's a lot of charities just working away, not publicized. They haven't got the money to spend on comms and marketing, so people don't know that they're there, but they are there. And there is information about that available, and I can provide information for the West Midlands. but there are others. The Small Charities Coalition represents 13,000, over nearly 14,000 small charities in the UK, and there are others. I've just put a link in on Twitter about the European Anti-Poverty Network. There are networks, other networks that need to be surfaced. There was a third sector European network, but that wasn't funded, so it left. It collapsed.
Yeah, so that's a really, really good point. Thank you for raising that, Pauline. I think there are a lot of resources for the support of people already out there, that because this is a new scenario for a lot of people who are encountering difficult scenarios for the first time, potentially don't know that support exists. And so going back to that first point, how do you make people aware of what those existing support networks are in their local area? But also coming back to the last point about supporting organizations, as you said, a lot of these kind of smaller charities just don't simply have the money for that marketing, for that change their services to be digital and online. So how can the community, how can everyone support them? I think is a really, really good point. Thank you to the person who asked the question about where people are. I am amazed at the different locations that we have here. So hello to everyone who's just recently joined the call, and everyone who's been here for the last kind of 30 so minutes. Welcome. I think let's move on. I'm going to say this is a shame every single time we have to move on, because I would love to have a longer conversation about this, but into the last point around helping people so helping people to the person who asked a question about whether or not I have a pro account. Yes, I do have a pro account, so we have the full hour, so it's fine, please don't worry. I just haven't paid the amount that I needed to be able to have more than 100 participants. So sorry about that, everyone who's arrived recently. But yeah, let's move on to helping your organization quickly respond to change, because I think this is going to be quite a interesting discussion, quite different to the discussion we've had previously, but touching on the point that Pauline just raised about how are we dealing with scenarios where actually we don't have a huge amount of money available to be able to change, or a huge amount of time. So who would like to kind of kick us off in talking about how our organizations can respond quickly to these changing needs?
So in my case, I'm pretty happy with the response that my company is having, because they are encouraging every employee to stop traveling outside the region that they're based, and focus on remote working. So I think this is great. It's helping everyone to still work while not being limited by the location they are.
Mm-hmm. Yeah, I think it's a good point. I mean, as designers, that can often be quite challenging. We're probably more used than most to kind of spending time with other people, collaborating, doing user research face to face. I can understand how that's challenging. So we've got someone.
Sorry.
Go on. Yes.
Sorry, I was going to interrupt you. It's Maddie again from Edinburgh. I think one of the things for us, just to echo what I think it was Daniel just said, was that as SCBO here, our IT team has been phenomenal in getting us up and running, and everybody remote working, though I work in the digital team, hence why I talk about it all the time. So for me, it's nothing new, but for our services like payroll and facility, it's learning a whole new language and way of working for them. So, and what we're attempting to do is to try and role model for the sector, to say we're all struggling with it, we do it every day. And I think somebody already posted right up in the chat right at the early, it's the same but different. So we're all, the jobs are essentially still the same, we're just doing it in a different way. And to try and take away a lot of the fear and panic that's around, how do I work from home? What does that mean? What do I do? And it's that behaviour change aspect that I think we are attempting to talk about the most, is that actually this is a behaviour change. The actual what you're doing is not different. It's just how you're doing it that's the key thing, I suppose.
Yeah, completely. Zoe, you said you can talk about barriers with public sector clients. That would be really interesting to hear.
So I'm working with Snook in Glasgow. So a lot of our, we're a service design agency, and we have lots of projects and different clients. A lot of our clients are public sector service delivery staff. So we were trying to come up with a way of rediverting our project budgets to just respond to crises now, rather than sticking to potential designs that now don't feel so relevant or potentially wouldn't be important right now during a crisis point. I think one of the issues we're finding is that a lot of the people that we're working with are just so busy and overwhelmed with what's happening. Is when is the time for us to step in and try and support them? Do we need to back off a little bit first and give them space to figure out what's going on, and then support further down the line when the new normal emerges? I just feel like I don't want to add more burden by trying to help and getting in the way.
Exactly, and I think it's that there's someone mentioned this on the in the document, that there is we have to kind of acknowledge the humanity of the people that we're working with, because they are overwhelmed as well. Someone mentioned on the chat a very good point around kind of engaging with risk and audit functions. Erin, you mentioned that. There are, I think it's one of the interesting things we're noticing so far is actually people kind of chucking a lot of the sort of traditional risk aversion, very careful behavior out of the window in kind of light of the fact that actually the risk of doing nothing in the scenario is far worse. And so interested to kind of hear how people are sort of, I guess, negotiating that scenario of trying to make sure that we're designing user-centered services in a world where people need to work very quickly, or potentially there are legal barriers. I don't know if anyone's got any experience they'd like to kind of share about that.
Could I come in?
Of course, please.
Right from London. So I work in a university. So we had to move very quickly. In about a week and a half, we had to switch to online teaching and move all our operations online. And I guess there's a few issues there. Obviously, there's risk associated with assessment, with students being able to graduate, and in a market where students pay quite a lot of money to do their degrees. It is really, really important that they can do that we continue to provide for them. But what we're finding is that, we sort of take for granted that we can move everything online. We found out, for instance, that we have students that were entirely dependent on university IT services and library services to come and do their work. They don't have any internet connectivity. They don't have laptops at home. And so on and so forth. And this is not only amongst students, it's also amongst staff. So we are now scratching our heads trying to find a way and design something that we can help, that we can support these people in order to, whilst we're saying everything goes on as normal and we keep delivering just in a different format, that no one is disadvantaged. And there are clear cases there where people are disadvantaged because they might not have the possibility, the training, and the actual sort of connectivity and devices to be able to work remotely.
Yeah.
So if there's anyone out there that has any ideas of how their organizations deal with these issues and what innovations we need to put in place in order to make sure that no one is left behind.
Yeah, it's such a good point. I think what you're raising there is actually something that's kind of come up as a theme in the chat, in the doc, and in the conversation, that so much of this is really a kind of highlighting areas of lack of knowledge about accessibility within our organizations that were always there. So we've always had students who weren't necessarily able to access digital kind of services. We've always had people who weren't able to pay their bills online. We just kind of probably didn't really know about it. Dana, you said you can share some thoughts if we've got time. I think we've got a couple of minutes before we need to move on to the last point. Would you like to go ahead?
Sure. I just wanted to say too, like, I can tell just from the chat conversations and the live conversations here that you have people who are focused on service design and focused on innovation. And we also have to keep in mind our employees' mental health, and that some of them are having difficulty with change, and we have to often pull back and capture our insights for later because it might not be the best time to change a service, so that you have the clout remaining when it is essential that you rethink or ask somebody to rethink what they're doing. You need to hold on to that innovation clout so that you don't expend it on something that's not worth it.
Yeah, such a good point. You know, mental health of the people that we're working with. I think, you know, very often design and user research innovation, whatever you want to call it, is often in conflict with the hello with our organizations. Hi to your partner. He's just been seen topless by many.
This is hilarious.
That was my teenager just coming in for a hug. I can't
oh, right,
remember the last time he gave me a hug.
Oh, that's very sweet. That's very sweet. Oh, I mean, but you know, classic example of life happens, right? And you know, we have to be compassionate to the people that we're working with. So really good point. Thank you, Dana. Okay, let's move on to the last point, because I think that's a good continuation of what Dana was saying there about kind of being understanding of just the context that we're working within right now. And this last point of really, if you kind of had to ditch all of these principles and all of these kind of lofty expectations that we've just been talking about, and you had 24 hours just to build something, what is the most important thing to get right? What is the most important thing to think about? I can certainly kind of hear that we've been talking a lot about accessibility and about understanding and being compassionate to people's needs. Would anyone like to kind of kick us off on that? We've not got a lot of time, unfortunately. We've got about 10 minutes, but yeah.
This is Andreas from Switzerland. They've been working on building something the last days. We have 26 cantons and the Principality of Liechtenstein. This is a small, country. And what we are doing basically is from bottom up collecting data about cases and hospital infrastructure in these 27 regions. And for me and my colleagues here, the most important thing is just to focus and do not get distracted by anyone now telling us how we should proceed. Just we know what's the gap we want to fix, and we fix that first before we do the other things, which should be important. But it's very hard to stay focused and not like turn people away and be blunt to them and so. Yeah. Thanks.
That's a really good point. I think there's a lot around kind of, if you'll excuse the medical metaphor, triaging our work and remaining focused on the things that are the most important at the time. So yeah, thank you for that. Would anyone else like to come in on this point? Yes, of course, Fiona, go ahead.
Yeah, so I just wanted to say, I think that we know the places instinctively where we can cut work down, right? We know the first things to slip if we're short on time, short on budget, short on people. And those are the things that we need to do in this situation. We know that if we can't reach end users, can we speak to organizations who work with them really closely and really understand them? Because in one conversation, you can get as much as you might do in maybe 5, 10 interviews. We already have people across the country who are working with citizens in any group that we can think of and that we're trying to reach and trying to serve. And I think reaching out to people in the places that they already are is one of the easiest ways we can put something together that works quickly.
Do you want to elaborate? What do you mean by kind of reaching out to where they are?
So I think in terms of organizations that they are engaging with, it may well be in terms of channel as well, or the activities that they're doing day to day. So I think, for example, we're doing a lot of work with COVID-19. I work for Scottish Government, and we are trying to engage with, I suppose, proxy users as and when we can to get things out the door really quickly. So that is bits of health organisations, it may well be third sector. So making sure that we understand quite quickly what the lay of the land is and who we need to speak to and where.
Yeah, no, it's a really good point. I think it kind of comes back to that point around preparation actually, and planning for a scenario where you may have to reprioritize what you're doing. I mean, in your situation, you know about those things. I've been in quite a few scenarios in the last few days where people don't know what they would drop, because everything is important all of the time. It's a really good point. Thank you, Fiona. We've got a couple of minutes left. Does anyone else have any other points on how we can support organizations to respond more quickly, and I suppose specifically more in a more user-centered way, more quickly to this scenario?
If I may, I would just want to, it might not be something that a lot of people can focus on right now, given that we're in crisis mode, but there's always this saying about don't let a good crisis go to waste, and I think maybe we should think about how we're learning lessons for our organizations, but also kind of more broadly society level, government level, and whatnot. And I think documenting this crisis and what organizations are doing and not doing, it will be very, very important. So yeah, for me it's about, okay, we're going to go through this, but what are we learning? It's a long last learning.
No, that's a very good point. Thank you. No, it's okay. Hi. Right, we've had babies and we've had naked teenagers. This call is complete. No, it's a very good point. I think a lot of the time, sometimes we are not necessarily kind of focused on what we're learning from a difficult situation, and actually some of these situations can help us learn in much more acute ways, much more quickly about our services and things we need to change than maybe any other point. And now is not the time to stop doing research or stop looking at our analysis. So I think a really, really good point there. Thank you. We've probably got time for one last point. If anyone wants to kind of pick up on what the one thing you would do if you had 24 hours to build a service, what is the most important thing to kind of get right for your service?
I'd like to say that now more than ever, people-centric design is important, because at the end of the day, it's as humans who are suffering this virus and the consequences of this virus. So now is the right time to encouraging people and organizations to become more humane and be more empathic with the rest of the humanity, I would say.
Yeah, completely. Very good point. Thank you, Daniel. And I think potentially a good point to end on there. We've had a huge amount of contributions on the chat in the shared document that have focused on exactly that. And this ultimately is the reason why I wanted to organize the call, is that so often in a crisis situation, design, user research, focusing on users is the one thing that we kind of forget about potentially, because we're so busy trying to kind of make something that just works. And actually now is the time to understand accessibility. It's the time to understand people's needs. It's this time to be compassionate and be empathetic to what people need of us more than any other time. So thank you. I think unless anyone else has any kind of closing thoughts, we should probably wrap it up there.
I just like to say something.
Yeah.
This is Radhika here. Thank you for the talk. I just wanted to say, like, I kind of realized that, we think through a lot of services that we think whether we want to launch them or we don't want to, but during these times of urgency, we don't really think about it too much, and the process of it getting actually launched accelerates, and then you just kind of think about, why couldn't we just do it earlier? In the sense where, like, it's so simple to just do it, and you could have done it long back. And then in times of urgencies, it just seems like the most, needed thing that needs to be done. And also, like, because people have like this common problem or like common established thought, they just like become more people centric as well. And I think that really bonds them together. Even if you see Instagram posts or anything like that, like even in Italy, like how they've been doing all of that, they've been coming on the balconies and all. It just shows how people want to come together as well.
Yeah, absolutely. No, you're totally right. I think it was interesting. I was noticing over the last few days, as so much kind of bureaucracy has been removed from so many different services. Even as a user of many services, the removal of the need for signatures, for example, when signing for post. It's a simple thing, but in the UK that's happened. So really, really good point, that actually a lot of the natural consequence of situations like this is to remove some of that bureaucracy. Okay, that was the fastest hour I think I've ever experienced. Thank you for dealing with my possibly slightly inexperienced Zoom workshop hosting, but this has been incredibly helpful. I hope you've enjoyed it. Thank you for joining. I will share the recording of this afterwards, so for those of you who weren't able to be here for the entire time, apologies for that, and I will also have a go at editing the document, because it is full of amazing insights, but is I think colloquially termed a hot mess, mostly because of my poor spelling at the moment, because I can't talk and write at the same time. But thank you all for joining. It's been wonderful talking with you all, not least to just feel like we have a community in this space. So yeah, watch this space. I will share both of those things. If we feel like actually we'd like another call to discuss those, let's do it. We've all got a bit of time on our hands. So, thank you all, and goodbye.
Thank you so much.
Bye.
Bye.
Thank you. Take care.
Bye.
Thank you so much.
Bye. Thank you.
Bye.